This morning on Talking Solutions, we have a special guest from Nevada HealthLink, Andres Ramirez. The whole issue of health insurance. We've got an enrollment deadline coming up very soon on February 15th. So this affects a lot of people. I know that I am very fortunate through Beasley Media Group. We've got our insurance. It's all taken care of. I don't believe that I personally need to do anything with this deadline that's coming up on the 15th. But millions of people do. Is that right?
Absolutely. The Affordable Care Act established a necessity to create what are called state exchanges. Here in Nevada, that's called the Nevada HealthLink. It's the marketplace where individuals who don't have health insurance and are required to have health insurance can go to purchase a plan which may or may not be subsidized by the government depending on their income. Also, for those who enrolled last year and still don't have another source of health insurance, they can continue to use Nevada HealthLink to re-enroll and satisfy the law's requirement of having health insurance.
You're mentioning re-enrollment. And just before we started talking on the show, you said that's one of the questions that you get from people a lot.
Yeah, there's a common misconception. We have several folks who say, well, Andres, I enrolled in this program last year. Why do I have to enroll again? And so we have to explain them that in the insurance industry, they re-enroll people on an annual basis. And that's because people's situations change. Either they may have moved, they may have gotten married, maybe they had a kid, maybe their income changed. There's a variety of things that could happen. And so to update everybody's records and to be sure, or maybe you just had a plan that you thought you needed last year and maybe don't need for this year. And so you want to change your plan to maybe be more expensive and cover more or cover less that you may not need. So it gives the consumers that option to ensure they're having the health plan that best meets their needs on an annual basis.
Do you find that people are really confused by the whole idea of health insurance? I mean, until fairly recently, it was not a thing where people were required to have health insurance. As you mentioned, the Affordable Care Act now makes that mandatory. We all need to have coverage. I know that there are a lot of plans out there. There are a lot of different directions you can go. You mentioned that you need to re-up every year regardless so that you can make sure that your plan is what you are needing for that period of time, for that year coming. And I just find that people get really confused with all of this.
Absolutely, especially the folks that we deal with who typically have not had health insurance before. So this is an entirely brand new process to them. But in America in general, unless you've been sick or you've had to deal with medical issues in the past, you don't really understand the concepts of insurance. The average American gets insurance either through their employer, which takes care of most of the paperwork for them. Most employees know they sign some paperwork and that they have insurance, or you get it through a spouse or a family member. So the average American doesn't really interact or deal with this process in an intense manner. So when you're that individual who has not had insurance and all of a sudden you find yourself, oh man, this law is here and I need to have insurance now. I've never done this before. How does this work? And so everything from what coverage means, what co-pays mean, what premiums mean, what a PPO means, what an HMO means, do you need pre-authorization, what's covered, all of those basics, our trained enrollment facilitators have to guide the consumers to explain what that means and what's best for them.
Yeah, there are a lot of initials related to healthcare. I know what an HSA is. I know what a PPO plan is. I got all that down. I'm good. But I think a lot of people do not. Plus, we have the added incentive, from what I understand, if you don't have health coverage, you could be impacted on your taxes as a result. Kind of a little penalty for not coming along and doing this like we are required now to do.
Right. If you're required by law to have health insurance, and just to be clear, not everybody is required by law to have the health insurance. There are exceptions, but essentially anyone who's in this country who is a citizen or is here legally is required to participate in this program. So if you're required to have it and you do not enroll in a health plan, you could be subject to a tax penalty when you file your taxes. So people who are filing their taxes right now for calendar year 2014, if they didn't have a health insurance plan during the year of 2014, they could be subject to a $95 penalty or 1% of their income, whichever is greater.
The bigger amount.
Yes. And for year two, so people are now enrolling for calendar year 2015. So next year, when people file their taxes, if they didn't have insurance now, then they would have to pay $325 or 2% of their income, whichever is greater.
So it's ramping up. So this year, reflecting back on what we did in 2014 is a smaller amount, but as we go on, it's more incentive, should I say, for us to get on board and get some health coverage like we are now required to do so that it does not impact us tax-wise.
Absolutely. I had a customer the other day who contacted us about this process, and he didn't want health insurance, but he didn't want to have to pay the fine. And when you do the math of what his fine would have been, if he chose to pay the fine, he could have used that actual amount of money to pay for his health plan. It would have cost about the same, and he would have had health insurance.
That kind of sounds good to me. I like the idea of insurance.
Yeah, so it's like you could have insurance and not pay a fine, or not have the insurance and still pay that same amount of money in a fine. And so it was just comical in the end. When he did the math, he was like, yeah, I guess I'd rather have the health insurance if it's going to, I'm going to paying this.
6 of one, half a dozen of the other. The only difference is cost you the same amount of money pretty much, except you've got insurance now.
Yeah.
I like that idea a lot better. I would imagine during the course of the day that you deal with a lot of inquiries, people who are just flat out confused because there are so many different options out there for insurance coverage, something that's tailored for what we need. Is that what you deal with all day long, is confused people?
A large majority of our job is dealing with individuals who do not understand the insurance process. Many of them who want insurance themselves, either because they've had a medical issue or because they want to ensure they're protecting their children and their loved ones. But yes, since they haven't filled out this process before, or it's largely been selected for them before, either through a spouse or their company, they're now the ones who have to make the decisions and figure out what matters to them. And so we guide them through a series of questions to try and figure out what makes the best sense for them. Some individuals come in and say, look, we just want the lowest price plan, bottom line. Like, I'm a healthy person. I don't ever go to the doctor, but I want to have insurance just in case, and I don't want to have to pay the fine. Great. So we can easily pull up, based on their data, here is the least expensive plan available to you, and oftentimes they'll pick that. Many of the times people will come in and say, well, I want to make sure that my primary physician is covered in this because I want to be able to go to this physician. For women, a big deal for them is they want to make sure their OBGYN is covered under whatever plan they pick. They don't want to have to switch.
Yes.
And so they'll say, I want to start off, I want to find out which plans cover my OBGYN. That's a top concern for me. And then they'll move on to other things, and they'll move on to price and to copay and to deductibles. And so based on the conversation we have, if someone wants a high deductible that's an HMO and covers this physician, then we can sort it out for them that way and make sure that they have the plan and coverage that best meets their needs.
It's like a little puzzle you put the pieces together for that individual. One of the things that I found interesting, too, we're talking with Andres Ramirez with the Nevada Health Link. We're coming up on a deadline for health insurance for you to make sure you're signed up for this year, for 2015. That deadline is Sunday, February 15th. A lot of questions out there. We thought we'd try to get some answers. One of the things, too, Andres, that I have found really interesting about some of the provisions that have changed with the Affordable Care Act is a lot of the wellness, like a mammogram, for instance, that I used to have to get pre-authorization for. Now it's just go. It's okay.
The Affordable Care Act did a variety of things in addition to establishing exchange. And one of those things is that they provided preventive services. So whether they're mammograms, whether they're your annual checkups, a variety of these things that people used to have to pay for, you now no longer have to pay for, and all of the insurance carriers that participate in the exchange or have qualified health plans have to provide these things to you at no cost. And so that's a huge added benefit. Oftentimes, the only time someone will go to the doctor is for their annual checkup. And even for that, they're concerned that, is my copay too high? Maybe I can't pay the copay, so I'll skip my annual checkup. Well, now there's no copay and there's no payment for your annual checkup. So if we can just start getting people to go to the doctor more regularly and ensure that they're staying healthy and not getting to the point where they've gotten so sick or they've gotten to an issue where now we're getting to the most expensive form of care for that individual, then it reduces the cost overall for everyone and it makes the system function better.
It's just a smart approach to your medical needs. If you don't get sick in the first place, it's not as expensive. I'm all for that. If somebody was looking for information about getting signed up by the deadline on Sunday, February 15th, What's the best way? I know I've been on your website. I'm talking to you one-on-one today. I'm sure there's telephones you can call, maybe seminars. What have you got for people to figure out what they need before the 15th hits?
The main website that people can get just about all the information they need is NevadaHealthLink.com. That is the main website for our exchange. It provides you all the basic information on where you can enroll, how you can enroll, and so forth. So that's an option that people have. We also have a store inside the Boulevard Mall, which is the Nevada HealthLink store. It's just on the other side of Macy's. There are people there who can answer questions for you, that can help you enroll in the plan themselves and deal with you in an in-person manner. So if you don't want to talk to someone over the phone, or maybe you don't have access to internet, you can go to the Boulevard Mall. It's open there Monday through Saturday from 10 to 9, and on Sundays from 12 to 7. And you can show up. You don't need an appointment. There are, on average, 30-plus professionals there that can answer your questions, and if you want to move forward, actually help you complete your application right then and there.
They know what to do. I know, Andres, we've been talking mostly about insurance for individuals like ourselves, but some of the questions that I've also heard have to do with businesses and small businesses and what they need to provide for their employees. I would imagine that Nevada HealthLink also can answer those questions, maybe even in the Boulevard Mall side for a small employer who comes in and says, what am I going to do?
Absolutely. At the Boulevard Mall, we have a great setup. We established a one-stop shop approach. So if you come in, regardless of what your need is, there is an enrollment professional that can help you. There are licensed EEFs, which are exchange enrollment facilitators that are granted by the HealthLink to help you there. But there are also private insurance brokers that work side by side. So if you come in and you have a unique special circumstance, or maybe you want something slightly different for your business or so forth, you have EEFs that can help you, or you have brokers that can help you, whether you're a business or whether you're an individual. They will be able to answer your questions and get you set up.
Between them, they can figure out what is best and least expensive.
If that's what you're looking for, yes.
I think in a lot of cases it is. People are very panicked that they need to have insurance by law now. With the Affordable Care Act, they're very, very fearful that there's a lot of cost involved with that.
That is a huge concern for a lot of the major businesses and mid-sized businesses. What we've actually seen is for a lot of small businesses, they're very excited about this. Small businesses before used to have to compete with larger companies in terms of offering benefits to their employees, and a small company couldn't negotiate with an insurance carrier the same way that a large casino or a major company could.
Sure.
But now a small company can offer their employees the same level of medical benefits to their employees that a large company can. So if you're a small business and you're trying to retain talent and, make it an attractive approach to keep your employees, you can say, hey, I want this plan. I can get that now, and I pay the same price that larger companies pay, and I can keep my employees. So for some folks, they're not just looking for the most affordable plan because they use it for a different aspect. But yes, in most cases, people are looking for the least expensive plan that they can provide.
Should people be panicked at this point, knowing that the deadline for enrollment for any kind of health coverage to make sure that they've got it with the Affordable Care Act, I know our deadline is Sunday, the 15th of February. Should they panic at this point? I mean, it's coming up on us really fast.
We don't want people to panic, but we do want them to act. There's still plenty of time to complete the application. It takes us on average between 20 to 30 minutes to complete an application for any of our consumers, and we have a variety of people available to help. For the 15th itself, we're doing something special to make sure that we can accommodate as many people as possible. So the Boulevard Mall itself, we will have extra personnel on site at the store, and we will be open from 9 a.m. to 9 p.m. so that we can help more people apply. In addition, we're having a fair at the Thomas & Mack and Cox Pavilion, which we call Get Healthy, Get Covered. And so from 11 a.m. to 7 p.m., we will have hundreds of people there who can help you enroll. So if you're unsure and you want help in person, we will have hundreds of professionals right there. So in addition to the Boulevard Mall, people can go to the Cox Pavilion. They will have trained professionals who can help them enroll. And in addition, we were going to have a health fair as a portion of that at the Thomas & Mack. So there'll be free screenings that people can get, whether they're dental screenings, vision screenings, and so forth. They'll be able to meet other resources available to them in the healthcare community. And so we want to make this as welcoming and as easy as possible for people to come and enroll.
An all-around healthy day.
Yes. So you don't have to panic, but you do have to act. and there'll be plenty of time and resources for you to get help. If you need the insurance, we ask you to please join us and to show up.
That sounds great. So that is on Sunday the 15th, a big final day push, not only at the Boulevard Mall from what you're saying, 9 a.m. to 9 p.m. that day, but also a big event at the Cox Pavilion, which you know is right there next to the Thomas and Mack. And what are the hours for it again, for Cox Pavilion?
From 11 a.m. to 7 p.m.
Gotcha.
We're setting the 7 p.m. deadline because we've done this before and we had a huge line at the end. The deadline is midnight. So whoever's in line by 7, we will rope off the line and still make sure that we can enroll those people. So we know we may stay there longer helping to enroll the people who are still in line. But yes, we know that if people are showing up much later, we don't want people to show up late and us not be able to get to them. So we know that if we cut it off by 7, whoever's still there, we should be able to help them enroll.
You'll have time to process those people still remaining in line.
Yes.
What is this going to cost, Andres, for your help with Nevada HelpLink, for individuals or businesses as far as getting the best guidance for the insurance coverage that is best for them?
So that's a great question because we're a very expensive firm and we charge absolutely nothing.
My favorite price.
The Nevada HealthLink and the Affordable Care Act provides grants and resources for companies like mine and others to be able to provide these resources to the community at no cost. Anyone who's looking for help, they should not have to worry about finding someone who's going to charge them a fee. Anyone who's a licensed EEF, an exchange enrollment facilitator, should not be charging them anything to help them with this process. If they go to the Boulevard Mall, they will not have to pay anything. If they go to the Cox Pavilion on the 15th, they will not have to pay anything. These services are completely free to consumers who need help.
To help you figure out what you need for you as far as your health coverage to make sure you're on track. The whole change with the Affordable Care Act, it has been a big shift. Have you seen a lot of people who didn't have coverage previously are now able to be covered with provisions that are now there?
Absolutely. The biggest benefit this has happened for, again, is people who are either self-employed or were unemployed on their own, but maybe they stayed at home and their spouse's coverage did not apply to them or was too expensive for them. So they're able to enroll now. Also, the chronically sick who had been dropped from previous coverage for pre-existing conditions. The Affordable Care Act eliminated discriminations based on pre-existing conditions. So if you had been sick before and either you were dropped or your premium became so expensive you could not afford it anymore, the Affordable Care Act now prevents insurance carriers from doing so. So we've seen several families come in here and do that. Last year during the first enrollment period, we had a family who came in and it was a husband and wife, and they told us, we haven't had health insurance for 17 years.
Wow.
Because we weren't able to afford it individually on our own. And now that the HealthLink's set up, they were able to enroll. We have families that come in and they leave crying because they're in shock and awe. They were actually able to get a plan. They've been used to getting denied because of pre-existing conditions in the past, and now they have coverage to help them. So for us, it's a truly rewarding experience to see the families, to see their faces, to know that on a daily basis, we're able to help people deal with their needs.
That's a tremendous peace of mind. Just to know it's that safety net that
Absolutely.
A lot of people didn't have. The stuff that goes into Washington, man, I can't even keep track. Actually, I don't think anything really happens there, but they talk a lot. And there's a lot of talk about we're going to change this, we're going to change that. As far as impacting us as individuals, should we be concerned about that, or should we just say, this is what the rules are right now? We need to make sure that we have coverage by Sunday, the 15th of February. That's the deadline, so that we won't have to worry about the tax implications, which for 2014, the taxes that we will be filing by April this year are smaller than they will be next year. We do need to re-up every year, which
Yes.
a lot of people don't realize.
Whether you're on a private insurance plan through your job or whether you're through the HealthLink, you're going to have to re-up every year. So there's always a lot of chatter in D.C., in the Washington bubble, as they call it.
I like that term.
And a variety of things could happen. The reality is that right now, this is what the law is. And in the state of Nevada, our state legislature and the governor opted to have a state-based exchange in which the state of Nevada governs it, that it is becoming self-sustaining, and they're deciding what's in the best interest for Nevadans. And so at this point, the most important thing that people can do is, despite what they hear on the news, this is the law right now, and it's impacting them right now. The great news, it's helping tens of thousands of Nevadans finally get the coverage they need and be able to provide for their families. This is a good thing for those families who've been without health insurance. I tell people that they can come down to the store, they can come to our events, they can see the countless families who are coming in who need help. This program is able to help them, and in the long run, it's reducing the overall healthcare costs for everyone.
A lot of that because we're doing a lot of wellness in our health coverage and saying, go ahead, get the checkup. You're not going to have copays like you used to have to worry about with that. Go ahead, get that mammogram. Ooh, fun. Things like annual checkups, mammograms, maintenance type health procedures. We're able to get those with no copays. We don't have to go through the whole pre-authorization process. I think, Andres, I'd like to just kind of recap real quickly what we've been talking about today. Of course, it's got to do with the deadline for enrollment for this year for the Affordable Care Act and all of the provisions. We need to have health insurance, and our deadline for enrollment is Sunday, February 15th. We were talking about coverage for individuals, coverage for businesses. Either way, if you're confused, if you need to know exactly what the plan is that is best for you as an individual or as a business owner, a great place to go. No fee whatsoever. Nevada HealthLink. The places that you have as far as where we could go physically to have someone assist us with this who really knows what's going on. Boulevard Mall. And on the final day of enrollment on Sunday, the 15th, all-day event at Cox Pavilion, where at 7 o'clock you go, okay, we're good, putting the ropes up. So you can get everybody processed because we do have a deadline of midnight on Sunday, February 15th. No need to panic, right?
No need to panic. Just take action.
And getting information as far as what is best for me, you guys can help us with that?
Absolutely.
Individual, business, whatever, Nevada HealthLink, NevadaHealthLink.com. I was just on the website a while ago, page after page of frequently asked questions, whether or not you're coming from the perspective of a business or an individual. Just about anything you would ask is already being answered for you on the website, NevadaHealthLink.com. It's coming up pretty quick, but no need to panic.
No need to panic. There is help and resources out there for you, and we're doing everything we can to ensure that we provide those services to help the public. The only reason to panic is if you're not doing anything, right? If you're wanting help and you want to take action, there is someone to help you. There are places you can go to, and this can be taken care of.
Positive thinking. I love that. Not much longer until the deadline, so definitely do take action. Sometimes when you don't know what to do, you just kind of freeze and you don't do anything.
There's no need to freeze. You can call the Nevada HealthLink at 855-7-NV-LINK. You can come to the Boulevard Mall. You can go to the website, all the contact information, the store hours, locations, all of that's on the website, and there's someone there to help you. You do not need to figure all of this out on your own. We're there for you. We want to do that, and we look forward to it.
Andres Ramirez, it's got to do with the Nevada HealthLink. You've given us some great answers today, and we really appreciate you coming to visit on Talking Solutions.
Well, Terry, thank you so much for dealing with this subject and making sure that the consumers here are educated. We know it's an important part of this process, so thank you so much.